Hi, I'm Dr. Guberman. So we're back with another video here at the Westmount Aesthetic Center for Surgery, and today I will take you through the process of a lip injection with a filler. So if you have any questions or you want to meet me in person, please don't hesitate and contact us. All the information is below this video. So when we're injecting lips, so this is a very popular procedure done with a filler. There are many types of fillers, and the one we will use today is from a company that makes a filler that's quite elastic and follows the movement of the lips and the muscles. So it's a filler that I like using for lips, but there are many choices out there. And these are very safe injections, but they have to be done in a way that still gives a good aesthetic result and nothing too excessive. So my philosophy with these types of injections is to really go low, go slow, and not do too much at once. It's way better to do this in a first session with a lower volume, reevaluate the patient a few weeks later, and see if we need to do more. One thing also pertaining to lips is before doing it, it's good to know the history of the patient if there is a history of cold sores, because this can induce a cold sore, and it's better if the patient does have a history of cold sores to take medication for this a few days prior to the injection. As you can see, when you look at her lips, she already has lips that are aesthetically pleasing. One important thing that I like asking patients is exactly what are the goals they're trying to achieve with this injection. Because everyone's different, everyone has different types of lips, and you want to try to align your procedure with what the patient would like. So here my goal is not to go with too much volume, but just to enhance the shape that she already has.
Okay.
So one thing to note is that the lips are a more sensitive area compared to the rest of the face. And in this filler, there is an anesthetic agent. So as I inject, it will freeze gradually. But one thing you can do is to use a topical anesthetic, like a cream, that can freeze and help with the pain just prior to starting the injection. So we're going to start the injection now. To inject. So the way I inject, there are different ways of doing this. I will essentially go at the junction of the wet and the dry lip. So I start laterally here. I'm sorry, a little prick. Now, when I go in, I go the whole way here. I want to test to make sure that I'm not in a blood vessel. Are you okay?
Mm-hmm.
And I pull back a bit, and there's no blood. I know I'm in a safe area. And I will start injecting slowly. Are you okay?
Mm-hmm.
And as I inject, I'm pulling out slowly. You okay?
Totally.
So we will have to massage this at the end, but right away we see a bit of volume. This is exactly what I want, just going slowly, okay? I'm going to do the same on the other side. So I like symmetry, that's very important. So I will go on the other side now. I'm always evaluating my volume I'm injecting as I go. All right, so already we see good volume here. And already with that small volume I put, almost 0.2 cc's, just that was enough to give something that's already pretty nice. At this point, I'm going to go in the lower lip. I like giving a bit more volume to the lower lip. The lower lip I find should be a bit plumper than the upper lip, okay? In this case, that's what I'm going to do. So we're going to do the same sort of thing, start laterally, wet and dry lip, okay?
Mm-hmm.
So she put that numbing agent, so she's feeling a lot less pain.
Super good.
Works well. And we're injecting here. I wasn't in a blood vessel, I tested. What's good about these fillers is that if you don't use all of it, you can keep it, and when you reevaluate in a few weeks, you can use the rest if you need to. So that's good. Patients know that there's some waiting for them if they need more. Okay, I'm going to go on the other side. Sorry. Test the artery. Make sure, all good. You don't want to inject into an artery or blood vessel or occlude a blood vessel. That's not a good way of injecting. It would be in a safe area. Okay, so now we look at her lips, and she does, can you open your lips a bit? She needs a bit more right here, so I'm going to just top that up in that area. Sorry. Okay, we test. Now the center, I don't like putting much here in the center. I don't want to disrupt that pout too much. So I'd rather there be a bit more volume on the sides laterally than in the center. This is in most cases, not everyone. That's good. Okay, so now we're going to massage the product to balance it out. Massaging is important. I really want to spread that product out evenly. Sorry. I want to make sure it's not clumped in one area. It's balanced out. And it's important that patients don't play with their lips after massaging or anything. We don't want the product to displace later on. We want it to stay exactly where we left it after my massaging is done. Yeah. So she is swelling up a bit already, but I would rather at this point stop. We have a bit of product left. We can keep it for her. And if she needs a top-up in a few weeks, I find it's a much more safe and it's a better approach to do it that way. Patients need to keep their head elevated for the next day, especially at night, for the swelling to go down. And like I said, no manipulation of the lips so the product stays in place. And this will last about 6 to 12 months depending on the patients. So as an extra bonus in this video, I will be injecting some Botox as well. Here, she doesn't have that much of an activation of her forehead. So Botox is mainly for forehead, calming the forehead muscles, the glabellar area, the area above the eyebrows, we call the corrugators, and the crow's feet. This is caused by the muscle around the eyes called the orbicularis. So I asked the patient to look up with her forehead. So I mark her out here. Her muscles are a bit active here, in these areas. I would also avoid injecting right in the middle here. Oftentimes many patients don't have any muscle in that area, so that's a common mistake, is to actually waste Botox going in the middle here, because it's mostly just a tendon. Now, her eyebrows are quite high, so I would not inject under her eyebrows, which has an effect of lifting the eyebrow. I think they're high enough and I would not want them higher. Now, you're going to frown for me. So this is that nice corrugator muscle. So when she frowns, again, I'm going to go smack in the middle of that muscle there to calm it down. And that's going to calm down those two lines we see when she activates. Frown again downwards. So her muscle isn't that active, but I'm still going to add a bit into the corrugators on either side. And that muscle here, because if you don't do that and you just do this, I find there'll be a bit of a disharmony between the forehead areas, and it gives a better calming effect to that central area. Now finally we'll go for the crow's feet. So we ask the patient to smile. So these are the smile lines of the crow's feet. So I'm just going to add, she doesn't have that many lines, but I'm going to calm them down a bit by putting, I would say, 2 areas like this. So there we go. Now we're ready to inject her. So now we're going to start the injection. So with the Botox, the injection is in a very small syringe and extremely small needles, so they're relatively painless. So we're going to start in the center here. So here it's a deep injection into that muscle. Are you okay? Mm-hmm. All right. So I put 10 units there. And now the corrugator, you want to stay above that eyebrow, not too close to the eyebrow. Right there. Another 5 there. Now we're going to come from the side for the tail end of that muscle. Sorry. Let's put a few units on that side and on this side. All right, we're done the central portion. How did that feel? Okay. So now we're going to go for the forehead, the frontalis muscle. Here we go very superficially, just injecting small little areas, very superficially, as you can see. Okay. Now we're going to go around the eyes. So here I like going away from the eye, safer, pretty superficial, and it can be a bit more painful around the eye. Sorry. Pretty superficial there because that muscle is right under the skin. So we're done the Botox. How did that feel?
Good.
Yeah? So we've done the lips and Botox, and overall you feel it wasn't too painful?
Not too painful.
It was a good experience for you? So this is the typical way it should be for this type of procedure. So thank you for joining us, and hopefully we can meet soon.